What's going on, everyone? Happy Saturday! Hopefully, everyone is doing well, staying safe, healthy, having a great day so far, and I really hope everyone is testing negative for all those viruses that can make us sick. It is time now for the Saturday edition of the Virus Update for Saturday, October 11th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed of what's going on with these viruses. That's what I do here on my channel each and every day. I give you the latest news, data, and really anything I can find to help keep you safe and informed. Want to stay informed? Just subscribe to my channel down below. Give this video a thumbs up by hitting that like button if you enjoyed today's video. Of course, share this video with anyone you know. Leave your comments down below, and ways to support the channel are listed down below. Already, we do have several things to take a look at today. And would you believe it or not, I didn't even do that much searching. No, I didn't. I just didn't get around to it today. And plus, I'm trying to stagger things out. We do have a holiday. We don't have the CDC data. So I am probably going to be doing a little bit of wastewater today, some tomorrow. And we'll take a look at wastewater on Monday as well. And whatever news stories I find, could be quite a few. All right, starting off now with this. From Sci-Fi, we do have several things from Sci-Fi today. California reports COVID positivity rate of 5.5% statewide as of October 4th. Southern California downtrend slowed significantly. That's not good. Orange County reports the positivity rate is 7.6%. Sacramento's region reports 7.1%. All right, taking a look at this, he did also post a thread recently, and yeah, things continue to somewhat improve in California. The statewide SARS-2 levels in wastewater dropped to the lowest levels since May 21st. That was as of October 2nd. 17 out of 82 sites are increasing, up from 2, which out of 83 last week. So a few wastewater sites did go up there, and it's not surprising. I think, though, as we are dropping here in the United States right now, I think the drop is going to slow somewhat. And, I mean, we're going to continue to fall for a few more weeks, but I think that rapid drop we were seeing, I think that is going to slow down. Taking a look at some other things in California. Flu. California reports flu positivity is starting to rise, but only incrementally with no exponential increases. Positivity is lower than 2 years over year. Positivity is lower than the last 2 years, year over year. It's not zero and never was zero over the summer. Let's pause and take that hydration break a little bit early today. Apologies, I'm a bit congested this afternoon. Today's been a bad, or I should say this afternoon has not been good for my asthma. I don't understand why, because this morning was fine, and now we're into the afternoon. Well, I kind of understand why. I'm very far away from the last time I've had my injection. Anyhow, moving on. Orange County reports lowest COVID positivity since July 12th at 7.6%. And influenza-like illness and COVID-like illness also shown. And you can see here, things are doing okay still at this time. Although influenza-like illness, you can see there, just an ever so slight increase at this time. San Francisco reports COVID positivity of 3.7%. Testing hit the lowest level since March 19th of 2020. Yes, March 19th of 2020. So that's rather interesting to see. LA County reports COVID positivity at 5.5%, higher than 2020 and 2022 and 2024. But again, a lot of people are just not getting tested, and if they are, they're using these at-home tests. So that is a big deal, and that is part of the reason why these levels are lower. There's San Francisco once again. All right, moving on now to Mike Honey, sticking with COVID, where he shows the latest variant picture with a global scope to late September. XFG Stratus was higher at 73%, NB.1, 8.1, Nimbus fell to 18%. At this time. Alrighty, take a look at this. Dennis the COVID Info Guy. A study of 74,738 COVID and 18,790 flu cases found COVID patients faced a higher risk of severe Long COVID within 6 months. Yikes. That's not good. Within 30 days, 826 COVID versus 89 flu deaths. Within 90 days, 1,391 COVID versus 149 flu deaths, showing worse outcomes for COVID-19. And for the person who's about to say, "Oh, it's the vaccine." Okay. You want to play that game? Before COVID came around, how come I never heard all of you saying, "Oh, it's the flu vaccine, it's the flu vaccine"? Never heard you saying that about flu. Excuse me. I hear you saying that about COVID, but never flu. It's not the vaccine. People actually do die of the virus. The virus does exist. All right, moving on to this now. We had to get our inhaler filled today. Where is it at here? This, right here, Breast Tree. And we did get our new box of Breast Tree today at CVS. And while I was there, I thought, you know what? Why don't I ask, do they have the Novavax vaccine? And the woman that was at the counter said, Novavax? She had to ask them. She didn't know what Novavax was. I'm like, oh boy, here we go. So, they asked the pharmacist. And mind you, where I live, we have a pharmacy problem that's ongoing. Of course, as you know, all the Rite Aids are closed, but we've also lost 2 other CVS's, so our CVS is absolute insanity. I mean, they got a lot of workers back there. I don't even know how many pharmacists they have, but she asked the pharmacist that was right there. And the pharmacist said, "Oh, Novavax, I think we just got that in." And I said, "Is it the new Novavax?" And she said, "Yes, it is the new one that just came out." I said, "Oh, fantastic." So she's going around looking for it. And she says, "Your inhaler will be ready in 10 to 15 minutes. Did you want to get that today? It won't cost you anything." I'm like, "Yeah, get me the Novavax booster," because I'm going to be very honest with you guys. I think it's been over a year and a half since I've had, maybe more than that now. Because remember, back in the beginning of this year, I actually had COVID. Was it the year prior? I don't even remember. I still have a date sticker here somewhere that says the last time. But what's time is time. So I got my updated Novavax booster shot today. Yes. And guess what? Someone else got a shot. I'm saying booster. And they even told me there, we don't call it booster, we call it vaccine. Okay. I got the Novavax vaccine. It's the second time I've had Novavax. All the ones before that, I believe, were the Moderna. Again, I'm not telling anyone to go out and get your vaccine. You do you. Someone else just got his COVID vaccination and flu shot. Yeah, take a look who. Surprise! President Donald Trump. Yes, the quote, President of the United States. He went out and got his COVID shot and his vaccination. And I do wonder, because I see all the nonsense on social media, I do wonder, if he gets sick for any reason this winter, are they going to blame it? Or are some of these people going to blame it on the vaccine? I don't know. I'll stop right there. But yes, the President of the United States did go out to get his vaccination for COVID and the flu shot. And I know his party, that's something they frown upon. So, hey, he did go out and get it. What's that telling you? I think that tells us that they really do know what's going on with these viruses. They just don't want to do anything about it. Speaking of viruses, we got to talk about another virus. Florida, whooping cough cases nearly double from last year. Florida Department of Health data shows. Get this. Tallahassee, Florida. We don't always see updates on these other viruses. We haven't heard about measles in Florida in a while. I haven't heard about a lot of things in Florida in a while. But when we hear about something from one of these viruses in Florida, it is never usually a good thing. Cases of whooping cough are at a 5-year high in Florida, with 1,079 confirmed cases so far in 2025, according to data from the Florida Health Charts. So there you go. Whooping cough cases in Florida are going up. Somewhere else in the South is dealing with a problem. This is Fayetteville, Arkansas. A case of whooping cough has been confirmed at Woodland Junior High School, according to Fayetteville Public Schools. So, yes, whooping cough is around. I'll be updating some of this over there on my site, datareport.info. I'm going to do some updates there this evening, some updates there tomorrow morning as well. There are some threads that need to be updated. I'm sure I'm going to find news stories as I do my searches later on. Okay, you're probably wondering, why am I showing Google Maps? Why am I showing Vermont? Well, COVID purposes, I've been talking about this. I think we did this last year on Columbus Day weekend. Now, the leaves peaked up there last week, but it's still Columbus Day weekend. A lot of people booked in advance to go for this weekend to see the Leaves. It's very crowded up there. It's been crowded in New England for the better part of a week now. Take a look at this. You can see the crowds here on the traffic map. You can see, oh, look at all this maroon. Yes, these are people going to leaf peeping, and they're going to have to eat dinner somewhere. So they're going to go to restaurants. They're going to have to stay at a hotel. Let's go over to New Hampshire. Oh, take a look at this. New Hampshire is just absolutely packed with people as well. I can think of several places in New Hampshire. Let's go take a look at Conway, New Hampshire. All right, this map looked a lot worse earlier, but you get the point. We're recording late today, 4 o'clock, because of this congestion business we've been having all afternoon. But you get the point here. New England is jam-packed with people this weekend. New England rates this week. Yeah, wastewater, it actually went up slightly. Gee, let me think. What could cause that? Could it be all these crowds of people going up to the resort towns of New England? Ding, 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 ding. Yeah, it could be. Somewhere else also rose today. Going to show you that in just a few moments. Let's take a look at bird migration. As you know, bird migration has been really high the past few days. And take a look at this. Let's see what happened today. Yeah, yet again, we're into hundreds of millions. In fact, we went over 400 million birds with a big migration from the Great Lakes and Midwest region, going from north to south. So birds are clearly migrating south for the winter. All right, let's take a look at air qualities while that refreshes. We got to pause and take another hydration break. My throat really needs it. Probably going to add some lemon to my water later on. If you haven't ever tried that, do it. Lemon and honey, if you're coughing like crazy for asthma or maybe you're sick, it works really well. All right, take a look at this. Just a few bad spots in the Mid-Atlantic. I'm not even concerned about that. There's a lot of low-level moisture. There's a coastal storm that's coming up. That's going to mess up things a little bit. And really, it's not that bad. Pacific Northwest still has a few problems, as does California. But again, this is much improved from what we have been seeing. All right, take a look at Pinellas County, Florida. Speaking of improved, that's the least number of calls we've seen in a long time during the daytime hours. Now, I don't usually look at it 4 o'clock on a Saturday, so maybe that's normal, but it's the lowest we've shown during a recording in a while, one of my videos. Philadelphia yesterday, 795 EMS incidents. Doing a live look in at Montgomery County. Hey, not too bad there either for EMS calls at this time. Taking a look at what's going on in Chester County. We need to refresh this. Chester County does show that EMS standby is inflating this a little bit, so X off about 4 of the ones that are listed here. We do see, though, sick person and respiratory difficulty is showing up here, so that's something to keep an eye on. All right, staying in Pennsylvania for a moment. Pennsylvania wastewater, when you look at the data, it's usually dated for Saturdays. Well, I happened to check it, just wondering. I wonder if it had updated, the actual site updated today. To my surprise, it did, and I'm not happy. They've actually corrected a few things. They've actually gone back and fixed some of the data on these. Yeah? Take a look at this. Remember we were dropping? And then we had that rise up until September 6th, then we're dropping. Look at this. We quickly went back to moderate levels again. Now, there's reasons for that. Reasons I have mentioned several times, although one I did mention, which was Penn State games up at State College, Pennsylvania. And if you notice there, the wastewater there is listed low. That's good. Now, there's another game there this weekend. As a matter of fact, it's going on right as we speak. It's the homecoming game. That's a big deal up there, homecoming. But there's something else that has caused Pennsylvania to go up. Let's go down to southeast Pennsylvania. Yeah, take a look at this. Some of these southeast Pennsylvania wastewater sites starting to show up high and even very high. Well, last Saturday, we had a trio. I believe it was a trio. No, we had 4 things going on at once. We had an Eagles game last Sunday. We had a Phillies game at home. We had our soccer team. We also had hockey. Our hockey team's not doing very well, but all that combined together increased the transmission. That's a large number of people. 4 different events. Then we had more events throughout the week. We have concerts that go on. You get the point. A lot of reasons for rises. Also, take a look at western Pennsylvania. Some rises there. Now take a look at what is going on in northeast Pennsylvania. Look at this, Wilkes-Barre. They were at 8. The value was 8, that's already very high. Yeah, now it has skyrocketed to 14.26. Now, just west there, they did have a fair that went on recently. I don't know how many weeks ago that was. I don't know if that's what's causing it. Something's clearly going on up there, but I do have to show you one last thing in Pennsylvania. XFG variant is dominating. What is the percentage for XFG? It's 88.71%. But an old variant, I believe this is an older variant, new to Pennsylvania, the XDV.1 is 11.29% of the cases. So you can see how that just randomly popped up over the last week. And I'm looking here. You can see here we have had that variant in the past. So I don't know why I'm saying that's new to Pennsylvania, but it just randomly came back. I don't know. That's what the sequencing is showing in our wastewater. All right, moving on. Let's take a look at New York State. We'll do the hospital situation again tomorrow for Pennsylvania and New Jersey. Positive cases. New York State yesterday, 544. New York State does report 436 people in the hospital and 32 people in the ICU. Take a look at wastewater, and you're going to see here there's a change. COVID's now low in the South, medium in the Northeast, medium in the Midwest, and medium in the West Coast. That's a bit of an update, but again, we're going to still have to follow these wastewater sites. Let's go to Montpelier, Vermont, and see what's going on there. Yeah, wastewater still listed high and going up a little bit. Let's go to the northwest of there. How about Essex Junction? Yeah, that's still rising for COVID. RSV is now listed at medium. And we do see, take a look at this, a pretty quick rise for norovirus all of a sudden. Going to have to keep our eyes on that. Also in Burlington, Vermont. Yeah, you get the idea here. High for COVID there, and norovirus is in the medium. I wish I could have showed you that town we were talking about a little bit ago, Stowe, Vermont. I wish they had a wastewater site. They get a lot of tourists there all year round. I've been there several times. I have relatives that live there. Yeah, it's a pretty big deal. Alrighty, ending today on some notes from CJS, some data from him, and starting off with the numbers, daily numbers for Thursday. Florida, 568 new cases and 19 new deaths. This is mainly for COVID at this point. We're talking about COVID right now, not flu just yet. Florida, again, 568 new cases, 19 new deaths. New York, 630 new cases. Puerto Rico, 132 new cases. Thursday, weekly numbers. Arizona, 854 new cases. Idaho, 337 emergency department visits. Indiana, 699 new cases. Iowa, 1,082 positive tests and a test case positivity rate of 10.3% during the period covering August 31st to September 27th. So a long range there. Kentucky, 608 new cases. Massachusetts, a net of 804 new cases and 4 new deaths. This takes into account 1 death from April of 2020 that was removed from the state's count. Okay, I guess they had to review that again. Michigan, 149 state-reported hospitalizations. Minnesota, unlucky, 666 new cases and 7 new deaths. Unlucky number of cases. The death numbers are lucky. Not good either way. New Mexico, 350 new cases. North Carolina, 410 hospital visits for COVID-like illness. And Friday numbers. Florida, daily, 321 new cases and 9 new deaths reported yesterday, and 2,838 cases this week, and still another 90 deaths reported over the past 7 days. Yeah, you're still in your summer death wave. Hopefully that comes down soon. New York, 550 daily cases reported yesterday, and for the week, 4,008 cases reported over the past 7 days, to go along with 18 new state-reported deaths. Puerto Rico, 102 cases, and for the week they had 955 cases, 5 deaths reported over the past 7 days. All Puerto Rico deaths were reported on Wednesday. California, 3,582 new positive tests and 64 state-reported deaths this week. Louisiana, still 568 emergency department visits for COVID-like illness, a test case positivity rate of 4.1%. Unfortunately, that did not drop much. It's almost unchanged. It's at 4% this week. And let's zoom this out so you can see this. 10, well, you can't see it. 10 new state-reported deaths. Now moving on to Montana. Usually weekly, but a 4-week update this time. 923 new cases reported over the past 4 weeks. West Virginia, 202 new positive tests and a test case positivity rate of 5.04%, down like an anvil from 7.54% last week. Wisconsin, 463 new positive tests a test case positivity rate of 4.9%, down from 7.2% last week. Alrighty, folks, that does it for the Saturday edition of the Virus Update. You'll probably notice on my X account, Blue Sky, maybe even over on Facebook, you may see a lot of posts from me this evening. I'm going to be doing some searches for news, so it may be that I find a lot of things and put a lot of things out, which obviously would mean a very busy Sunday tomorrow. We'll have more wastewater tomorrow. We'll have all that news, maybe some state dashboards. It just depends on how many things I find. And if it's a lot, well, then we'll do a continuation of wastewater again on Monday. If you enjoyed today's video, give it a thumbs up. Subscribe if you're new down below. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. For me and my congested voice, I'll see you all again tomorrow. Hopefully this will be better tomorrow. Stay safe, everyone. Have a fantastic Saturday evening. Thanks for watching.